Founded in 2006, VDI is indeed your specialty reference lab. And what defines a specialty lab? Well, novel tests are developed here. Working with prestigious universities and specialty centers, these new tests are fully validated through clinical studies. And all this work makes its way to publication. It's this heavy lifting that sets VDI apart from routine lab providers. VDI has assembled a series of novel biomarkers used for diagnosis and monitoring in the fields of cancer, infection, inflammation, and immunity. Using this focused approach, VDI provides comprehensive, non-invasive blood tests used to aid clinical decision-making in a variety of settings. One area where we've gained particular experience and expertise is in cancer diagnostics and therapeutic monitoring. So let's begin here. Your decision-making tree begins with both patients that present apparently healthy but possibly harboring hidden disease and those presenting with clinical signs. And often, the signs you are presented with are these classics: lethargy, weight loss, lumps. The problem is they are very nondescript, leaving you with few clues as to where to begin the search. It could be cancer, or a wide variety of other diseases that present with similar signs. So where do you begin? That's where VDI factors into the process, with tests specifically designed to aid diagnostic decision-making in a variety of clinical settings. Let's take a closer look at tests designed for dogs and cats presenting with clinical signs. The TK cancer panels are tests designed for suspected or confirmed cases of cancer in dogs and cats. The panels incorporate two distinct biomarkers. Thymidine kinase type 1, TK1, is a measure of rapid abnormal cellular proliferation. Acute phase proteins, specifically C-reactive protein and haptoglobin, are measures of systemic inflammation. These two independent variables, TK1 and the acute phase proteins, combine two distinct hallmarks of neoplasia: rapid, dysregulated cell division and systemic inflammation. The algorithm developed to integrate the dual biomarkers produces the resultant neoplasia index. Beginning with the canine panel, it's used diagnostically to confirm the presence of neoplasia when you encounter suspicious signs, those that are typically associated with cancer, as well as those classic nondescript signs. Following diagnosis, the blood test is used to monitor the effectiveness of treatments, including chemo and radiation therapy, targeted therapies such as protein kinase inhibitors, and surgery. The feline panel is a blood test designed to aid in the differential diagnosis of intestinal lymphoma and IBD, and to provide an alternative to surgical biopsy, or at a minimum, insight as to the most likely cause when pursuing biopsy. Using the neoplasia index, the panel separates the intestinal lymphoma and IBD groups. Using an NI cutoff of 8 provides the ability to rule in malignant disease with a high degree of certainty. The value of incorporating the inflammatory marker becomes more apparent when separating normals from the IBD group. When haptoglobin is below 65 and the TK is normal, IBD can be effectively ruled out. Here is an example of the panel's clinical lab report. Included are the individual quantitative results for the proliferative and inflammatory markers. The integration of the dual markers is presented in the form of the neoplasia index. This proprietary algorithm generates a numerical value and classifies the result as negative, positive, or high positive. The lower portion contains the monitoring section, chronological plots on any given patient, and the contextual interpretive comments to aid in results interpretation and suggested course of action. Example reports include 2 cases submitted for a suspicion of cancer. A positive result, as depicted here, represents a solid rule-in for neoplastic disease. This case not only generated a negative NI, but given the very low levels of both parameters, neoplasia can be ruled out with a high degree of confidence. Using the panel to monitor therapy allows for a quick assessment of the effectiveness of and response to the treatment protocol. As depicted here, the drop of both parameters to normal levels is a positive response to treatment. When a patient does not respond to treatment, whether due to the advancement of the disease or ineffectiveness of the agent or protocol, this pattern can be expected. Progressive elevations in TK is a clear indication of disease advancement. Following definitive surgery, the panel will assess the completeness of excision. Once a post-surgical baseline is established, periodic analysis is used to confirm disease-free status, or as an early indication of cancer recurrence or metastatic spread when the parameters rise in unison. Now, our focus on cancer extends to a family of tests optimized for specific clinical settings. So let's shift our focus to wellness screening. A comprehensive wellness screen must detect a full spectrum of early-stage occult disease for better outcomes and lower overall treatment costs. And since cancer affects 1 out of 3 dogs and 50% over the age of 10, it should be among the targeted diseases. InCase does just that. It casts a wide net covering many diseases, including cancer. InCase utilizes the same biomarkers found in our canine cancer panel, TK1 and CRP. However, in this panel, we are looking to detect occult disease in the otherwise apparently healthy dog. A university-led landmark clinical study was conducted to evaluate these biomarkers. 360 apparently healthy dogs from across the U.S. were recruited. All the dogs were seen by a veterinarian at the time of blood draw, and the dogs were followed for at least 6 months. So here we have a group of 360 dogs, represented by these green dots. None of them are displaying signs of illness, and your job is to figure out which ones will develop cancer in the next 6 months. During the course of the 6 months, 11 dogs developed cancer with an overall incidence of 3%. However, since none of the dogs had signs of illness, the challenge is how to discern the occult cancer cases amongst the overall population. Applying InCase with TK1 and CRP, VDI developed a statistical algorithm that integrates these two markers into a risk assessment score, which allows us to group the dogs by degree of risk. Every dog gets a cancer risk assessment score. The CRA score goes from 0 to 10. The lower the score, the lower the risk. When the score is below 5.3, risk is very low. But when the score exceeds this threshold, there is an increasing degree of risk. In those exceeding a CRA score of 9, 40% develop cancer within 6 months. Conversely, the low-risk group had a very low risk of cancer, given the pet owner assurance of a clean bill of health. Cancer cases become much easier to identify. Thus, the CRA score effectively concentrates where to devote valuable resources. But InCase does not stop there. We know CRP from numerous studies to be very sensitive to a wide range of inflammatory diseases, such as heart disease, kidney disease, and autoimmune disorders. In this study, death was selected as a universal endpoint for serious disease. Now, certainly, more dogs developed illness other than dying, but if you only looked at death, those with an increasingly elevated CRP had a higher mortality rate, more than 1/4 of the dogs compared to those with low CRP. In essence, one simple test predicted which dogs may die. As you can see, CRP becomes a very effective screen for the detection of a wide range of occult diseases and a valuable tool for early screening. The InCase lab report provides a CRA score with an assessment of overall cancer risk. It also provides the concentration of CRP, flagging elevated values, where other non-cancerous disease may be hidden. However, there is one more biomarker that is very useful during a wellness screen, and that's vitamin D. VDI has been on the leading edge of new discoveries regarding the importance of vitamin D. Specifically, 25-hydroxyvitamin D, when found insufficient, has major health implications, including an increased risk of cancer. Vitamin D enters the body, where the liver converts it to 25-hydroxyvitamin D, or 25D. The kidney then converts this to the active hormone 1,25-dihydroxyvitamin D, or 1,25D, which regulates calcium hemostasis. A more recent discovery is the role vitamin D plays in maintaining cellular health. On just about every cell in the body, there are vitamin D receptors that allow vitamin D to enter the cell. Within many of these cells, 25D can then be converted to 125D, which is then involved in gene regulation. However, this process will only occur if there are sufficient levels of vitamin D. Thus, maintaining what is termed vitamin D sufficiency is important to maintain the health of all animals. The growing body of evidence points to low stores of vitamin D being associated with a wide range of diseases in addition to cancer, such as heart disease, kidney disease, and much more. For dogs and cats, vitamin D is derived from their diet, not sunlight. Most often, commercial food becomes their sole source of vitamin D. When a wide range of healthy dogs were evaluated for their serum stores of vitamin D, more than 75% were found insufficient. Over 40 different brands of dog food were evaluated, and as the chart shows, Some fell into the deficiency category. For ensuring vitamin D sufficiency, we offer a simple blood test to determine the vitamin D level and, if warranted, to supplement. The cost of the test is minimal, but the payoff and reduced disease risk is great. Today, VDI has both canine and feline vitamin D assays that accurately measure 25D. The test is designed to be part of the annual wellness screen and especially over the age of 5 as absorption decreases with every passing year. The VDI lab report not only provides a quantitative assessment of vitamin D stores, but if found insufficient, will calculate the level of supplementation needed to achieve sufficiency. Equilibrium requires 4 to 6 weeks to achieve, and retesting is needed to ensure sufficiency is attained. Now let's shift back to pets presenting with clinical signs. Another recent addition to our growing family is our PTH 1 to 84 calcemia panel. Hypercalcemia can be associated with malignancy, but abnormal calcium levels can be associated with other diseases as well. This is the only test on the market that incorporates a uniquely designed parathyroid hormone that eliminates interferences and quickly sorts out endocrine disorders. This panel measures and interprets interrelationships between 3 biomarkers. To maintain calcium hemostasis, PTH and vitamin D work in concert to increase or decrease calcium absorption and/or resorption. As vitamin D increases, PTH decreases. Plotting the relationship between PTH and calcium helps quickly identify the likely cause when one or both parameters are abnormal. The chart indicates when a normal relationship exists when the plot falls within the green zones. When outside the normal limits, the chart will indicate that the hypercalcemia is likely due to malignancy, or primary hyperparathyroidism when the plot lands in the designated box. Hypocalcemia is broken into likely causes including secondary hyperparathyroidism or hypoparathyroidism when the plot lands in those designated boxes. Critical infections can often look like cancer initially. For an acutely ill dog, this blood test will let you know quickly whether the infection is the cause, as time becomes critical in stabilizing the patient. The panel uses a VDI proprietary biomarker, NT-proCNP, that is secreted by the vasculature during an infection. Rather than guessing if a patient has an infection, a simple blood test can now quickly rule in or rule out if an infection is present. We also provide a series of standalone inflammatory tests that quickly rule in or out a wide variety of inflammatory diseases in dogs, cats, and horses. These tests are useful in wellness applications like pre-anesthetic screening and for the therapeutic monitoring of the acutely ill. VDI offers a growing number of unique specialty tests, all designed to help you quickly find answers in the most cost-effective manner. That's what we mean by the right tests for the right decisions.